It's Friends Living Well.
We're just girls. We're just fucking girls. And I've never claimed to be anything but a stupid girl. We're just girls.
Welcome, everybody. Episode 39 of Friends Living Well. Excited to be here for another one. I'm Nikita Mahone, co-founder of Full Living Wellness, and Kelsey Hunter, BCBA of Full Living Wellness. We have a number of services available, including individual, family, and couples therapy. We also have coaching for parents, as well as coaching for anybody that identifies as neurodivergent. And you can find those services. We'll have everything linked for you below. We also have a number of really cool events coming up on night that I can't wait for, especially now that I know you're going, Kelsey. We also have another one that's coming up September 23rd. Karith over at Nimble Craft has been really awesome at collaborating with us and making events special for couples to come in, have some time to reflect on things together within your relationship, do something creative, bring something home from that activity together, and just have a really fun time together. And they're usually during Dining Under the Stars, which is special in itself.
So don't try and park on State Street because it will be closed.
Don't do it. If you know, you know.
Yeah, we have the Nimble Craft event, and then Nikita's actually hosting a panel for the Wrestle Like a Girl event that's being hosted by Suli, who is one of the previous guests on the podcast. Shout out Suli. One of my parents that I support listened to that episode and really loved it, and also loved the episode with Danny. So yeah, Nikita's going to be hosting a panel on August 29th at the Wrestle Like a Girl.
It's a really cool thing that every age is coming, and that way other girls can see what that trajectory looks like for them and what the options are and connect with other mentors. I'm going to be there to just facilitate conversation between the athletes and the audience and help everybody get to know one another. I'm super excited about it.
Yeah, it's good. It's really cool. I think that being in this field and having this platform has really opened up opportunities that maybe we wouldn't expect. So these are things we like to do. So if there's people listening that have organizations or events and like are looking for people to help with those things, don't hesitate to reach out. You know, you miss 100% of the shots that you don't take.
That's what they say. Something about a tree falling in the woods and did it.
Michael Scott from The Office ripped it off, and now every time I say it ironically. So yeah, we got a couple events coming up, which is super cool. And today we have not been on screen together in a minute for the podcast.
It really has been a hot minute.
Yeah, it's been a long time, but we're excited because the Lindsay Clancy trial is on everybody's mind right now. There is so much discussion happening on social media about women's health and postpartum psychosis and psychosis in general. And oh my gosh, the husband, there's so much to talk about. So we got quite a few requests to share some thoughts. So my thought, Nikita, was that I was maybe going to ask you a lot of questions because I think you're the person that has the expertise in psychosis. You have more lived experience.
Okay.
So I think it would probably be helpful, like, to hear kind of from you, like, how you conceptualize psychosis. Like, what does it look like? What does it mean? Because I feel like the internet can be really polarizing about these issues. And I think
everybody's got an opinion right now.
Yeah, and it's hard to understand. I think that we can't expect to have an extremely nuanced conversation just via like comments and videos, but that's why it's cool that we have this podcast. That way we can have the
Yes.
conversation.
Maybe we should start too, because I just know that this topic, this case, this lived experience is also just a very sensitive one. So I think almost like a disclaimer within a disclaimer, I just want to give a minute to say that we understand how personal this is and also how many women have experiences, whether that's not necessarily with psychosis, but most especially with postpartum depression and anxiety. So I know that this is near and dear to a lot of people's hearts. And so I just want to acknowledge that and also say, take care of yourself in this. Like, I know that there's a lot of coverage and media around this, and that can be really hard to avoid. But if this is really difficult for you and is activating, take your time, take a step away if that's what you're needing to do. Always prioritize what's best for you. And this episode will be here when you're ready to pick it back up. And then that probably is another good disclaimer within it is working with so many families and children and parents. I didn't know what your experience there was. So I thought it would be a good opportunity for us to start by maybe even covering, because you're right. I am certified even in the treatment of psychosis. The basis of my work from community behavioral health, where my focus was on severe mental health, and that very commonly involves psychosis in it. I have a passion for working and treating psychosis. But I also do not have any experience working with postpartum psychosis.
Yeah.
So that's big. And even with that great deal of experience, if I had somebody come to me with postpartum psychosis, I would consider that a crisis and all hands on deck. So that's not something that I treat. It's not something I have experience in. So I'm very excited to talk about it. It's a needed conversation, but I did want to put out there where my experience actually does come from when talking about psychosis, and absolutely where the limitations of my experience are as well.
Yeah. I'm happy you gave that disclaimer, because I do think that we do try to approach these topics, these sensitive topics, with like a lot of care and consideration. And so, yeah, this is a sensitive topic for a lot of people. I have extremely limited exposure to working with individuals with psychosis. I've worked kind of peripherally, maybe, like I've been asked questions about it. I've had a couple, I want to say maybe 2-ish, 3-ish families that I've supported that has a child who's experiencing psychosis. And I think that that's an area where, you know, we talk a lot, BCBAs especially, talk a lot about scope of like competence and areas of specialty. And this is an area that I have solicited other people's expertise in. Because I can speak to some understanding of behavior and maybe how psychosis could present behaviorally if we're pathologizing it, if there's a need to, right? Like if I have a kid who is all of the sudden, you know, expressing that they're hearing things, or maybe there's like homicidal ideation or things that are related to their psychosis. I could have a conversation about that behaviorally, but that's really not an area of expertise for me.
Some observations to make, and
and it's fairly limited. So that's where, you know, I really value being on an interdisciplinary team where I can speak with other professionals that might be able to educate me even in the conversation. Because I don't like to say that a label or a diagnosis necessarily treats, or like I treat it differently, because behavior is behavior, but it does matter in context.
Oh yeah, especially when we know the context is people get really hurt. And
Yes. And I think the thing that I've had the most experience with is that like the content of the conversation, or the content of what this person is experiencing and what they're saying to their parent, how challenging it can be to know, what do I say? Like, is there something I can say? Do they really believe what they're saying right now?
Talk about, I can see that from a parent's point of view. If they're learning that about their child, then how do you support them, relate to them, understand? That would bring up a lot of questions.
Especially if it happens later in their development, right? Like, so we're not necessarily having psychosis related episodes when we were 8, 9, and 10, but now we're aging into adulthood, and maybe there's an onset, and then it's like, well, how do I conceptualize this? Like, is this just autism? Is this just ADHD? That's a conversation that we have a lot at CHOP, is like, how do we differentiate between the traits and symptomology of like all of these comorbid diagnoses
that can have such overlapping experiences. And especially like when we're talking about psychosis here, we're talking about something very episodic. And one of the terms that's often used to describe psychosis is waxing and waning, which means ebbing and flowing, coming and going. The spectrum of that changes and oscillates throughout the presentation.
Yes.
And I think that's a really awesome point that you're bringing up and starting with, is everybody's trying to make understanding of this, but we're talking about something hugely complex and something that has probably changed throughout, in the case of Lindsay Clancy, has changed throughout her experiences of becoming and being a mother.
Yeah.
So, all right, we were able to cover a little bit of our histories there. And I guess the final disclosure of that is that Kelsey and I are going to make probably a ton of errors throughout this conversation. And this is a trial and a case that is it happened years ago, but the trial is happening right now. And so with that new information is always coming out, we're always learning. To be patient with us. And if you do notice that we say something incorrectly, share that in the comments. Like, please put that information out there and correct us, grow with us.
Yeah. This is a fluid conversation. What I say right now, you could listen to 3 years from now and it could be totally wrong. So, or it's just wrong. So, we're going to do the best that we can as people that are navigating talking about this topic. Probably for me, it's kind of like a first time conversation, especially about postpartum psychosis, which also makes me want to shout out. We just did networking with Sunstone Psychiatry. They specialize in women's health. They specialize in this area. They are really great at treating this. They work often with therapists in co-treatment. So if you're looking for resources, that is a good place to start.
Totally. Yeah, we will link them. And I know Ashley and I are kind of playing with an idea of maybe doing like a part 2 to this and seeing if somebody that specializes might be available to sit in with us. So that way we can continue the conversation, because there is so much within this case and how it relates to systems at play that I think we could probably make a couple episodes of.
I totally agree. Totally agree.
Okay, so I feel like you set it up really well a second ago. You said that this is your first conversation around this. So it kind of makes me want to bounce the ball to you and see what questions are you sitting with at the moment, or where do you think a good place to begin might be?
Yeah, I think for me, one of the big questions that I have, it's a question that's being discussed in the trial a lot. And it's a question I have and I've been asked, which is, can I look for meaning in what somebody is saying when they're experiencing psychosis?
Yes.
So that's the question of like, I wouldn't ignore that. I shouldn't ignore that, right? They're telling me something, but is there meaning to it? Like, how do I respond?
It makes me a little bit curious about, where does the question come from? Like, is it the idea of like, this person might say something I disagree with, or like they might ask me, hey, do you see this? And I don't see that thing there, or...
Yeah, that's one example. The last example you gave, I think, is a good example. But another example I could give you is one that I've talked about with a parent, which is the individual was saying to the family member, are you my real mother? And did you adopt me? Or like, are you my real mom? Where's my real mom?
Okay. So there's a really good distinction in what you just brought out. I find that there is always meaning and purpose in the narratives that are within the psychosis. So the story that's being told, the delusion that is believed in that moment, there is always something that's related to that person, their beliefs and their fears usually. However, I would never recommend engaging in an argument or trying to persuade somebody who is in an active state of psychosis. This even reminds me a lot of when you are working with anybody that's experiencing dementia or Alzheimer's. So you would not engage in an argument of, yes, I am your daughter, I am your child, here's this, like, but you would want to emphasize safety and love and support. You are safe. I am your child. I'm always going to love you and take care of you. I'm here. You're safe. Those things usually will calm down somebody that's in an active state of psychosis much more than engaging in an argument would, same as somebody that's in a state of dementia as well.
Yes. Oh my gosh. Okay. That was really validating, because that was my instinct in my recommendation to the family, which is like, there's questions here about identity. There's questions here about, who am I to you? Do I matter to you? Do you love me? Do you care about me? So there are these like underpinnings that I do feel like you have to listen to. And that's something that I will say about like any autistic client that I support, because and not to say that psychosis and autism are the same, they're not. But there are statements or scripts that are said that feel random. They're like tangentially related. And you're like, does this mean something? Do I respond to it? Like, what do I do with this? So
and it is a bizarre experience, because it's not necessarily rational. It doesn't necessarily align with what you're talking about or make sense right away. So there is that question of how am I supposed to approach this now, or how do I especially approach this in a helpful way?
Yes. And the conversation, one of the most recent clips on the Lindsay Clancy trial that I saw today was that they were interviewing somebody who was doing like a mental status examination for her, which could be a doctor or a psychiatrist. It could be a lot of different people. But she had reported to this person that she heard a male voice tell her to kill the children.
Yes. Yeah.
So a lot of the comments were, it's the husband, it was his voice, like he told her to do that.
Let's maybe even pause for a minute. Because we're starting to get into like the possible theories and all that stuff. And I do even want to check in with one another about like, what are some of our thoughts, and then get into but I also want to keep in mind that like I checked in with Yuri, my husband, this morning about this. And like, he knew other than like the headline of the case, like he knew nothing of it. So I kind of do want to do a little bit of just like a snapshot of what happened. And I feel
okay
that I forget what year this happened. I want to say 2023. 2023. Okay. So in 2023 is when Lindsay Clancy was arrested for the murder of her 3 children. I want to make sure that we go through. So her 3 children, their names, Cora was born in 2017, Dawson was born in 2019, and Callan was born in 2022. They were all killed by Lindsay in 2023. So 1 year after her last child, Callan's birth.
Yes.
All of these children were under the age of 5.
Mm-hmm.
So just to that's 3 children in a span of 5 years. She has since been arrested. She is currently in trial. She has admitted to killing the children. She, in her defense right now, is not arguing the fact against having murdered them. She is, however, arguing that she was not in the right state of mind. And that the not right state of mind was a result of her psychosis. And so that's really where the conversation is at now, and where her defense team is. Nobody is arguing, not even Lindsay is arguing that she didn't kill her children. And so that's a little bit of a review. And I think that brings us now, because I know even myself, when I first heard this, I was like, oh, wow, is there some super long Chris Watts styled con that happened here where Patrick Clancy became a father, realized he didn't want to be a father, noticed his wife starting to suffer with postpartum depression, and formulated this, like I said, long con plan of like how to annihilate his family and start a life over again. Like that was definitely a theory I saw circulating online. I was like, that sounds absolutely crazy. But we've heard of things like Chris Watts. Like we know that these things actually do exist and happen. So here you can't help but be curious and want to make sure that you follow that line of thought. So that is out there. Where are you at with it, Kels?
I think the thing that is really striking about this case is that there's not often a case where I feel like you have somebody who is outwardly showing, like, I don't know if it's regret, but outwardly showing emotion and outwardly showing how distressing this is. Like, I think for her as a person, it's very obvious to me that she's in like extreme pain about this. But I think that it keeps hitting me. How many women do you and I know just by ourselves that experience these challenges with their health, go to doctors and feel like they are not believed or taken care of? And, you know, what could that mean for their livelihood or, you know, their families and things like that? I think it's bringing up a lot of questions about, you know, medical care and the medical care that women get. I have a lot of questions.
Yeah. And I think we're going to end up getting into a lot of them to kind of sit with that further. I guess I'm thinking of the 2 different outcomes that people are believing in. One is that Patrick is the actual person who murdered his family members, and then has created this narrative to put it on Lindsay. The actual trial that is happening on the other side of that is that Lindsay murdered her children, which she herself, to this day, years after, still states that she has done. And following that, and now the focus then becomes on her state of sanity during that time, her level of psychosis presentation, and all of the variables that are at play leading up to that day in 2023, which involves a tremendous amount of treatment care, which I think we'll absolutely get into. And I'm a little bit of a scientist in that way, where I'm like, unless it's in front of me and I've seen it, touched it, proven it for myself, I always keep a little bit of a variable open. But at this time, because Lindsay herself is leading with this admittance and, like you said, great deal of remorse for the murders that she says that she's committed, as well as the fact that her defense team has not brought up this other side that there's any potential at all that Patrick could have been involved, I'm much more on like the 95% side that Lindsay did unfortunately kill her children.
And the prosecution right now, their job and what they're suggesting is that there was premeditation to the killing of her children, but due to the psychosis that she wasn't within the right state of mind. So essentially that's kind of the job of the prosecutor right now, is to prove premeditation, and the job of the defense right now is to basically say this wasn't premeditated, and that she was experiencing postpartum psychosis, which then, like you said, we can go into all of kind of like the details of what that looked like. I think the other thing that a big part of the conversation is not only the psychosis, the mental health, but also the action that she took that resulted in big, serious changes to her physical capabilities as a part of this incident.
It's a really good point in our review of things. We didn't mention that not only did Lindsay unfortunately successfully take the lives of all three of her children, she then made several very large acts to take her own life. That involved self-harm, and then
she jumped out a window.
It was a second-story window that she had crawled out of. I think that's the wording that everybody is using. And the result of that, the most substantial of the injuries, when she fell out the window, she landed head first. So a lot of the medical examiner evidence has been equating this to if you were to dive into a swimming pool and land head first. That's the equivalent of the damage that is done.
Yeah, she is paralyzed from the waist down. And that's been a big part of the conversation, is not only like her mental competence, but then it's also like the physical competence related to some of these acts of self-harm. So there's a big question about timeline and mental capability in premeditation, but then also physical capability in carrying out the crime against her children. So all of that is actively being discussed too.
Yeah. All right, so we could go into more about like the actual treatment team, because I think that's another thing that really stands out about this case is how large the treatment team was and how many people were involved. But even before we do that, like, let me even check in with you about other things around psychosis that you might be sitting with, or I don't know if we even really gave like a review of what that is, or if we should.
Could we give maybe some examples or like presentations of what psychosis can look like? Because my understanding is that psychosis presentations are not the same person to person, and that there's all varying. When I think of psychosis, I think of like visual and auditory hallucinations, but I have a feeling there's more there that I don't know.
Those are the primary two things. There is auditory and visual hallucinations. It's really any sensory too. So I'll start from like a broader point, which is psychosis is a symptom, and it's not a diagnosis itself. It's a symptom of many different diagnoses. It can be part of the presentation of schizophrenia, bipolar disorder, major mood disorder. It can be present because of substance abuse, even from head damage. It's also very common within perimenopause and menopause. So it is a symptom within itself, and it is usually hallmarked by the presentation of a hallucination, a delusion, and disorganization in some way. So disorganization can come out in speech. So this can look a lot like you're listening to somebody and they're saying a lot, but it never leads anywhere. And it even picks up on 10 different topics, but nothing is ever cohesive or makes any sense. It's disorganized. And then the biggest ones are hallucinations and delusions. So delusion, it's fixed in false beliefs. Hallucinations, on the other hand, can involve involve all of your sensations. What people most typically think of is somebody talking to something that isn't there, or saying that they see something that other people don't see, which is very common. Out of all of the kinds of hallucinations that you can have, auditory and visual hallucinations, auditory specifically, are the most common. But you can also have tactile, you can smell things. For perimenopause and menopause, that's one of the most common forms of hallucinations actually, is I hear women talk about smelling nail polish and burnt toast all the time.
Really? What is the science behind that? Like, is that just a symptom?
It is a symptom, and it has to do with hormonal changes and olfactory senses and neuropathways within the brain. There's a lot there, and but it's not just one presentation. I've worked with individuals that also have very tactile, so they'll feel something touching them when nothing is there.
Yeah, I worked with a child, and at least in my specialty, sometimes there is misunderstanding or mischaracterization when some children that I've worked with are saying that they see things, hear things, or feel things.
Mm-hmm.
Sometimes it's not due to psychosis, it's due to them potentially observing changes in their environment related to those comments.
Developmentally appropriate.
Yes. And so that's where, again, it comes back to this conversation I have with so many professionals, but also parents, is I don't want to pathologize everything. Sometimes it is just a behavior. Sometimes kids just say stuff, right? But there's this really fine line, I think, when you're working in behavioral health and mental health. What's the gray area in between those things? How do I treat you and find meaning in what you're telling me? And then how do I also make sure that I'm not pathologizing a behavior that's developmentally appropriate, basically?
Oh, yeah.
Yeah.
And especially when you're talking about these kinds of disorders, because there is a whole medical side of things and treatment to look at. But as you're saying, all of our hallucinations and delusions come from our own perception. Our mind is the one that is creating these things. And so they are built and structured from our own lived experiences. And that is why so often they mimic and hold archetypes of the things that have hurt us most, wounded us most. And in my work with psychosis, that has actually been a tool and an asset to our healing, has been talking about what was the window that was opened about that person's truth and their wounds, and then how, once they're in this place of stability, how can we actually address those things? Because it came out for a reason. It's the same thing of when I hear women give themselves a hard time about PMS, and they're I'm just making stuff up, I'm just worried about this, and I'm nah, girl, that doesn't happen. Everything's just brought a little more to it. All matters to you. It's all always there. It's just right now a little more on the surface.
Yep. Yeah. No, it's such a good point. And I think that it's helpful to hear how different it can be for individual people, that it can look really different, and that it is so related to our hormones and our brain and our neural pathways. My other question is, my understanding is that psychosis tends to have an onset later in life, but I don't know how true that is.
For men, it usually actually has an earlier onset. Very unfortunately, I know Ashley is going to know exactly who I'm talking about. I think Ashley and I about once a month meet up just to talk about the clients that we worked with in community behavioral health that experience psychosis, because of just how much we love them, miss them, think of them, and just take a moment to reflect together, because we're the only two people that have that shared experience together, and send them love. But I'm thinking of somebody that we had both worked with who extremely bright, driven, an athlete, outgoing, force of life. And thankfully, they had a lot of family involvement. So we were able to see who they were prior to the diagnosis of schizophrenia really setting in. And within only 2 years, complete and opposite personality presentation, flat affect, verbalized minimally, constantly experienced hallucinations. On the worst days, would also experience paranoia. So went from a star athlete that believes that their child was going to have their entire future, everything was available to them. And within 2 years, this disease removed the personality of that on surface presentation. I even want to really point that out, because through expressive writing, creative writing, even theater, that vibrancy, that personality we saw was still very much there. It just was accompanied by new parts of self.
Yeah. And that then also, to the point you made before about like reassuring love and safety and, when they're sharing what they're experiencing is so important, and leaning into that and not necessarily trying to negate the experience necessarily or argue against it or logic your way out of it, but saying, yes, this is here and this is what we can do to make you feel safe right now.
I also really want to put out there, because I don't know if everybody thinks of psychosis in this way. You probably have had more experiences with people that have psychosis and just don't know about it. People think psychosis is the person that is lost in their orientation. They don't know where they are, what year it is, and they're just like talking to something in the corner. It's not even there. That can be what psychosis can look like. A lot of times, though, people can be experiencing psychosis and be completely functional, professional, out in the world. You would never otherwise know it. And so I really want to highlight it's not necessarily these extremes all the time.
Yeah, that is, I think, how the mind works. A lot of the time when we're thinking about examples of things, like, I think a lot of people, myself included, my instant thought is like agitation, right? Like agitation, irritability, erratic behavior, right? But it's not always like that. And that was, a point that I was hoping we would discuss today, basically, is like, what is functional impairment? Like, can people with psychosis, continue to care for their children? Can they have a full-time job? Things like that. I think that's probably, if I have the question, I'm sure other people do.
Yeah. And the answer is, psychosis is, especially because it is episodic, it has days where it comes and goes, or some people experience an episode and then there's a gap between episodes for a year or two. So totally, like, very functioning. Some people only experience psychosis during extreme distress in their life. So maybe they just had a grief and loss in their life, and now they're having symptom presentation of psychosis that otherwise isn't there. Impaired is certainly what it can look like, but it can be very functioning. And I think with that, more common than people expect it to be.
Right. Which is, to the Lindsay Clancy trial, so many people are like, how did she get all of this treatment and she was still caretaking these children, like getting them to school, taking them to doctor's appointments? Like, I think that's another conversation that people are having, is like, how did somebody do that?
Yeah, I know people have seemed to really struggle with that. Like, how isn't it that she's just like not rocking back and forth and like completely gone? And it's like that's not always what it looks like.
Right. And I think that there is a lot of people that live in the world that have, mental health diagnoses that are extremely functional, right? Like, how many high performing, people might have ADHD or OCD or, a brain that processes information in certain ways. It sometimes can be advantageous in specific careers, but then you have these extreme examples of the rocking back and forth, right? Like, it's not only those two things.
Totally.
There's a lot of room in between.
So much. And I think that can be even hard for people to accept, is that the person that they love might go through many different presentation stages where this disease or psychosis as a symptom just looks very different throughout. It's really hard for us to sit with.
Yeah, it's really hard. I think, like, to my professional experience with it, the ebbs and flows, the waxes and wanes that you're describing, is something that we often try to make sense of, or a trigger, or look for an environmental event that maybe precipitates this. And I think the really hard part about, psychosis and other similar diagnoses is that my understanding, again, is that, it's this biological mechanism that's coming from within, that it might not, to your point, there are distressing events that certainly could cause this. But I think for somebody that is the specific person I'm thinking of, like, there unfortunately wasn't a trigger.
Yeah. And it's usually not that the event triggers like that specific symptom. It's just whenever any of us are put into distress, extreme stress, we're going to have something activated within us. And based on our family histories, our lived experience, that presentation is going to be different. For some people, that's psychosis.
Yes, right. That's such a good, it's we shouldn't ignore that could be one of the things that our body and our brain does in response to. Right.
And even in my experience, so you had asked me a couple of minutes ago about like onset essentially of this. And so I find, and this is just like more of my own experience, I have found that if there is a largely genetic component, meaning that person is usually able to identify somebody else within their family lineage that has also experienced psychosis or that same severe mental illness, that onset does come earlier. I have also seen people where maybe they don't have a history or that history is even further out, and it takes a very significant, very distressing situation. Like I'm thinking of people that have been like abducted, kidnapped, like very as distressing
Right.
as you can get for a prolonged period of time, where that mental state then activated a level of psychosis or symptoms that maybe if they never experienced that level of stress for that long, they would have never presented that way. But it was obviously in their history somewhere.
Like having 3 children within a 5-year span.
So on that note, something that's really interesting is Lindsay Clancy reported having auditory hallucinations following the birth of her son, Callan, in 2022. That was the first time that she had reported, I'm pretty sure, of auditory hallucinations.
Yeah.
However, after every birth, so after Cora and Dawson, she reported each time higher levels of postpartum depression and anxiety levels. So just as we're talking about that spectrum, which I hate the term baby blues, but that's where it kind of starts, is baby blues. And then we go into more severe, we're getting into postpartum depression, anxiety diagnosis. If that severity presents even further, now we're talking about breaks with reality and orientation to time and place. Now we're in psychosis levels of things. So there is this spectrum and a growth within the diagnosis and how symptoms present with that too.
And it sounds like what we've talked in previous episodes about how, there are certain features of a diagnosis that have to be present. And for depression and psychosis, well, I think depression specifically, amount of time experiencing the symptoms is also a really big factor in diagnosis, right? So it's like you could say baby blues, that's like a common thing that's being said, but then when it gets to a certain amount of time,
Yes.
then we start thinking, oh, maybe there's something else that's happening here.
100%. And yeah, after those few weeks, it's like, okay, now we're getting into other areas of diagnosis, which I can make a whole bunch of arguments with on if any of that is even accurate, because women need much more time to heal from birth than is kind of clinically modeled within the structure there. But yeah, that's a whole other thing. So she significantly worse symptoms after each of her 3 children. I also just learned this. I did not double check this fact, so I actually will after we record. But I actually learned that Lindsay apparently signed up and completed a run either the day of or the day following the birth of her last child.
I also saw that, and so many people were having a conversation of like, that doesn't seem like that. I saw people using terms like that seems like a very manic decision, like really questioning
Yes.
why that was occurring, why others in her life, quote unquote, allowed that to happen.
Yeah, it was just, that was one of the most bizarre things that I had heard earlier today. I feel like in the past day, I've taken in so many facts about this case, and all of them have kind of like fit where, and that one really stood out of exactly like a very manic, the rationale of that, of why pushing yourself to do that and feeling physically capable and wanting to after you just gave birth really stood out to me, of like what was happening psychologically there, where her framing was.
Oh yes. And to your point, there's been so much of really big parts of this trial have happened literally within the last 10 days. Like we're getting the psychiatrist that was treating her that she saw 14 times between September 2022 and January 2023. We're seeing the testimony from these people. We're seeing the number of medications she was on at a single time, how many changes were made.
We kind of started there, but we didn't even touch on the narrative that Lindsay had. And when I first sat with this case, because of my experience with psychosis, that was my first question. I was like, what was her belief system behind this? And what did she think was happening here? Because psychosis, even though the narrative in the real world doesn't make sense, there's usually a pinning of truth there for that person. So I think one of the most common examples that I experience with people is anytime that they would go to leave their house, they would hear a voice tell them, don't leave the house, it's not safe. If you leave the house, you're going to get robbed. There's somebody right outside the door. And in working with them, what we would usually find out is that that voice was a very protective feature. It was maybe that person did get robbed in the past. And that voice is like, just stay in the safe spot. We don't want you to expose yourself to that. So there's always, even though it would make no sense, like you say to somebody like, oh, this voice just tells me not to leave the house. And you're just like, that doesn't make any sense. Like there's nothing wrong. There's nothing happening. You've lived here for 10 years. There's always something that will follow a line of truth to that person if you let yourself be curious and open yourself enough to meet them where they're at. It doesn't have to make sense to you in your world. Just meet them where they're at and it will make sense.
Yeah, and her timeline and her narrative that she's telling all of these professionals, from my understanding, is I'm not well. I'm having these thoughts. I'm worried about myself. I'm worried about these thoughts. I'm worried about the care.
Yes. He specifically said that the auditory hallucinations told her, this is your last chance, kill the children so you can kill yourself.
Yes.
So, and this is not just on the day of when she committed the murders. This was the hallucination that came forward and how it presented throughout. It was always this male voice, and it was always telling her that she had to kill the children and then she had to kill herself.
Yes. And I think that they worsened in intensity, or what they're alleging, right? That like with increased insomnia, lack of sleep, that's when we saw, I think, more emergency room visits, or like when she stayed at the inpatient psychiatric facility. It seemed like the insomnia was a really big factor.
Probably the biggest one out of all of them. On a medical note, there's like 2 points that I really have a hard time with this case on. One is the sleep. I mean, I'm a stickler. Anybody that works with me knows that if you have PTSD, specifically like any kind of trauma, I am 100% sleep cycles have to maintain, because if not, the uptick of other symptoms that go with that is highly, highly correlated. We can't even argue that. So sleep is number one. The second thing that really bothers me about this case is, and I'm glad for this reason that it's coming up, is women's hormones health. So Lindsay Clancy had 3 children. At no time was a blood panel done. At no time was a thyroid panel done. At no time was her hormone levels looked at and assessed. And as somebody who works with a lot of women going through different areas of their hormonal cycles, I cannot help but wonder how many of her psychosis symptoms, her anxiety, her depression, all of her symptoms were related to hormone health instead of the SSRI and psychiatric medications that she was thrown on. I really wonder if that's what we're looking at, in addition to what you're talking about, the classics of just like self-care. She should not have been left to be a primary caretaker to anybody. This is somebody who needed a primary caretaker. She needed to be able to sleep, because that would have eradicated, if not all, the majority of these symptoms. And she needed to have her hormones looked at to see if, before just medicating, if there are supplemental treatments that could have been in place there to provide her hormone replacement, which I'm almost certain she needed.
Yeah, I mean, and think about all the research that's coming out now on the rates of dementia with women that could be prevented with hormone replacement therapy. There's so many conversations to be had. That's why this is such a nuanced conversation, right? Because there's so many elements. You could really comment on the state of, women's health and women's healthcare, specifically in the United States. You could look abroad to see how they're supporting mothers who are giving birth, what kind of like treatment and care. You could look abroad to psychiatric facilities that have mama and baby wards. So that way mothers who are experiencing postpartum psychosis are able to stay with their baby during a really formative time in their life and get psychiatric care.
Yes.
Right?
So options available.
So many, but it's, I'm sure everybody who listens to our podcast knows that we're kind of like F the medical system and insurance.
Yes. But that's also why I get a little excited. You know, that's what Full Living Wellness was built so much on. We want to help people, but we also want to dismantle a system that doesn't work. And we want to create a system that will work. And so conversations like this get me excited because I hope that everybody that has a sister, loved one, friend, wife that is having a child knows you should ask questions about her hormone health. If you notice these symptoms, you have every right to ask questions about that because unfortunately we do have to advocate for one another. And I guess that's the best thing that can come out of this absolutely horrific situation.
Yeah. If there's anything great that comes out of it. But yeah, there's so much to be said about what is needed for mental health supports that is not psychiatric medication. Like, sounds like she didn't need another prescription of frickin' Abilify and Risperidone, right? Like,
She was on
so much.
Zoloft, Prozac, amitriptyline, Seroquel, Lamictal, Ativan, Valium, Klonopin, and Benadryl.
All in the span of a very short period of time. And you and I both know, as people that have worked in medical systems where we're working in conjunction with psychiatrists, a lot of the time, good psychiatric care does not involve changing multiple things at once or prescribing multiple things at once because we don't know what is going to be responsible for potential side effects, changes in mood, changes in, auditory hallucinations, whatever that may be. So for me, hearing the number of medications in addition to the 14 telehealth visits, a 5-night stay at an inpatient psychiatric facility, multiple emergency room visits, really concerning to me that she was on that many medications.
And another thing with that is it really feels like it highlights they're not just they're physicians. Like, you have a obligation to rule out medical causes first. And we were talking about a woman that gave birth to 3 huge medical events. Giving birth is a huge medical event. And it does not look like any of her medical causes were looked at in depth before the psychiatric medications were given to her. And again, I cannot imagine the impact that would have on somebody if they're having psychosis symptoms as a result of a hormonal imbalance. And instead of treating the hormonal imbalance, you treat it with antipsychotic medications and SSRIs. It is probably the exact opposite, the least helpful thing that you could do. And then send her home where she's still a primary. There's a lot. And obviously you can tell I'm getting a little angry about it as we get into it too, because it's a infuriating thing to look at so many steps that are basic steps that feel like they were skipped. And in that, I even want to cover, because I don't know if everybody will know this. So Lindsay Clancy had a large family. She had her own mother and father. She had the support of her in-laws as well. She had a sister. She had a therapist, an OBGYN, a PCP, a nurse practitioner, and a psychiatrist. In addition to that is her full-time team. So these are primary people that she's established with and sees regularly. In addition to that, she made several attempts at using resources of crisis hotlines, and she also went to the perinatal and postnatal unit of her community. So it's basically like the birth center where you're supposed to be able to go to in Rhode Island. She went there specifically because that's what they specialize in, and was told that she was presenting as over-medicated. That's a whole thing that we can get into, because apparently her nurse practitioner just never called this program back. So this program released her the day that she was admitted, citing that she was over-medicated and that was the issue. Called her nurse practitioner to report that they wanted to connect her to other resources. The nurse practitioner never returned or followed up on treatment of that. And this was just left. And also, I want to point out those crisis units that she called, they also turned her away.
Which is, that to me is also buck wild. That is crazy to me, that, because how many times have you and I said to a patient, dial 988, dial, right? If you're experiencing a crisis, and then to think that if we tell a patient to do that and then they do it, and then those people turn them away or don't recommend that they go to the emergency room or don't connect them with further care, like, what the hell is the point of having these people?
Exactly.
You
And that's
know?
where it reminded me of even your work in how, what does somebody do when they're sent home and there's no other resources, which is what I know so many of the families that are dealing with severe autism, where it's just like the psychiatric hospitals don't know what to do. They don't have the equipment, and then they send you home. And it's like, well, then who do you call?
Yeah, it's a huge gap in care. I can't tell you how many kids I've done consultation with that not only have behavioral acuities that are so severe that they can't stay in their community, in their home, but they also have medical complexities such as vision impairment, or maybe they're not mobile, and there is no place for these kids or people, right? Like, units don't exist for people with those things, but we know that units do exist for women experiencing postpartum psychosis, PMDD, all of these things that it sounds like she was crying from the rooftops, please help me, I need something here. And I think that's why us becoming angry about it, I think it's another level, right? Because we're both women and we both experience women's issues. And I've personally experienced poor care as a woman directly related to my health, right? So then when you see it play out and you see that the result of poor care could literally be the death of children, it's like, what are we doing here? What are we doing here?
Right. Yeah. This isn't like in the 50s where a woman kills all of her kids and then everybody goes, oh, well, nobody knew about mental health and there wasn't anything in place. This happened. The only criticism I can give is that at times which if you're half out of your mind, how do you know to disclose everything and what you have said and haven't said? But there was gaps in what was shared. But overall, everybody knew enough information to know that this is somebody that should be hospitalized. And this is the biggest thing that I would stand on. If Lindsay Clancy had been hospitalized, if somebody would have put her in a hospital, that woman, her 3 children, they'd be here today and she'd be okay. She would have
100%.
stabilized. She would have been able to receive whatever medication or hormone therapy she needed in order to stabilize. She would have come back to her senses. She could have had supervised care. Everybody could have been fine.
Yeah. And just hearing, especially from the mental health perspective, where you and I have this experience, hearing what some of these people were writing down as a part of her mental status examination and then not recommending inpatient care blew my freaking mind apart. And it also made me really grateful for the colleagues that I have at CHOP, because you can have criticisms. There are so many people that are doing really good care there that are like, this sounds really concerning. Oh, this is what we need to do about it. It was just it was shocking to me hearing what she was reporting and that nobody was taking what it feels like ownership. There's this weird, like, throwing around of responsibility that I'm sure people understand as a patient, but I think, like, as somebody working in a system, watching physicians throw around responsibility of care or decision making is like one of the craziest things.
Yeah, it's negligence. It's laziness at best and it's negligence at its worst. And then the result of it was that Lindsay Clancy was left to fall through the cracks. Everybody hoped everything would be okay. And instead she killed her 3 kids.
It's such a sad story. And now I think now they're going through the nitty gritty basically of demonstrating or trying to demonstrate that her mental status and also her physical injuries, like, kind of prevented her from engaging in a premeditated act. At least, like, that's what the defense is trying to argue. Right now, it's hard to tell. There's There's a lot of nitty.
Medication can become part of psychosis, which I think is the hard thing. It goes back to that functioning level. The delusion and the hallucination there is that I need to kill my children. I need to kill myself. And so she was functioning. It seems like she did even orchestrate this plan to create enough time for her to act out this delusion.
Which is also the waxing and waning of the symptomology. I could see that being confusing, right? Like I could see that being confusing, or her giving an appearance of lucidity and having really borderline answers on her mental status exam.
I believe it was to her therapist, Letitia, that she was afraid of being fully transparent with the severity level of her symptoms because she was afraid of her children being taken away.
Yes,
so
and
that is a very common reason of why women do not disclose the severity of their psychosis postpartum, is because they are afraid that their children will be taken away.
Yeah.
Which opens up a whole lot, because I've actually had this with somebody in psychosis, and needing them to know that there was a game plan with their family of the kids won't be taken, they will be safe, they will be here, and you need to disclose what you just shared with me so you can get the proper treatment. So people that can give you can know that this is your actual experience.
It brings up a point of like high quality care, right? And what that is involving. It also really brings up that trusted relationship with her providers, because I don't think it's difficult to make a jump between the number of people she saw and spoke with and how that would relate to her trust in providers and wanting to disclose. There's so much about that. And I think you talk a lot about like, how do you build a relationship with the people that you're serving, and how do you do that in a way that doesn't make a person feel like my children are at risk, or my life is over, or I'll lose my job, or right. And it's really tough, again, because when we talk about these issues on the internet, it's really polarizing, and it brings up a lot of, for me, moral questions about like criminality and like mischaracterizing specific acts, and thinking that people need to be punished for everything that they do.
That's already happening.
Right. So I don't know. I just think it's just really sad. It just like makes me deeply sad that she was trying to seek help, and it just seems like nobody wanted to throw their hat in the ring and be like, yup, I'm taking the lead. Yup, you need inpatient care. You know?
Oh, yeah.
Which brings in the husband then, which brings in like what everybody's talking about like his culpability.
Oh, yeah. I don't know what I would love to hear. I have seen so many demonstrations from Patrick, from Miss Clancy, Patrick's mother, so the mother-in-law, from Lindsay's parents, that have been so loving and caring and have demonstrated that they obviously had a great deal of love and respect for Lindsay and felt that she was an amazing mother. But I cannot understand why Lindsay was left to be a primary caretaker to her children in the state that she was in. It just does not make any sense to me. Even Yuri was like, is it like that you had to pay the bills? When I was talking to my husband about this earlier, he was like, did the husband was like, oh, the bills have to be paid? Like I have to go to work and like nobody else was available? Like how was she left alone? And I was like, I would love to ask that. Like, how did that happen? Because she was very clear of, I'm having thoughts of harming my children and harming myself. I don't know if that's like you're saying, was it not taken as seriously? Was it a matter of like, life is just life and I don't know what else to do?
It's really hard to say, because I have been a witness to not necessarily. Yeah, that is true. I have been a witness to scenarios where harm was being done. Behavior was concerning, and there were caretakers and individuals that were not taking active steps to remedy this scenario. And I think that there's so many things that we could make assumptions about, like another person's experiencing, right? Grief, acceptance, anger of what their reality currently looks like. How psychosis or mental health can fundamentally change your relationship and interactions. I think that one of the big issues that's coming up is that people are trying to make assumptions or characterize what their marriage was based on what's happening right now. And the information we don't have is was their relationship dynamic prior to having children, prior to postpartum psychosis, and during postpartum psychosis, because that's where I would be able to maybe start making some inferences or statements about what is his role and where was he in this.
Yeah. I can understand those questions coming up for people. And it does feel like that before picture is something that people are still trying to formulate. Even though everybody has shared, they had a very loving relationship. I think anybody knows, most especially any parents know, that going through becoming a parent is one of the most beautiful and one of the most challenging experiences you can have together. And only the two of you know what that's like to have those late nights when you're up and go through those changes together. And so I do wonder, what was that like for them? I'm even just now thinking of so many of the families and couples I work with, what they expected, what they didn't expect, where they found themselves, and needing the time and space to process what that lived experience has been. And so, I wonder what was that for them, most especially when obviously Lindsay's mental health was getting significantly worse with each child.
Right. And so then she, we have all this documentation of medical care she was trying to receive, the medications that she was on, and then there's all of this forensic evidence that they're trying to make a point of. And the thing that I've been really hung up on about this case too is specifically how critically ill she was when she was found, her body temperature, the injuries that she sustained when she was found. There's a lot of questions circulating about how was she able to complete these acts towards her children if she had a 3-inch laceration on her neck. And she was there's a lot of questions about whether or not she could have been able to complete that act.
I would have to see and know more about the incision myself to know, because you can have a lot of incisions and actually be pretty okay. So I wonder about that. But the one thing I do know, because I was really curious about the temperature shift as well. I feel like I've heard a lot of people mention how was her body temperature so low, and even comparing that to the Karen Reed case. Because Karen Reed's partner, who was killed, was found in a Boston snowstorm after he had been out there for 5 hours. And his core temperature was the same as Lindsay Clancy's when she was found, I think, only an hour or two of being outside. And that also felt, when I was first sitting with, did the husband do it? That was definitely one of my questions, was did he harm her and leave her out there for a longer period of time, commit these acts, and then come back, type of a thing. Actually, 2 variables that I didn't know about at the start that I'll share with everybody as they're sitting with that temperature shift. One, her clothing was wet. So it was 32 degrees outside, 32 degrees, and she was wearing wet clothing.
Yes.
The second thing that I didn't know about, and I know you'll find this really interesting, the damage that was done to the nerve bundle around her C1 vertebrae. So part of the medical examiner's testimony was that the reason that she believed that Lindsay Clancy's temperature had dropped so low was 1, shock, and 2 was because of having damaged this area of her spinal cord, and therefore was not able to regulate her body temperature during that time. So I did a really interesting medical cause to explain possibly even why in a short period of time her body temperature did drop so low.
And it makes a lot of sense because people who are paraplegics or quadriplegics have a really hard time with temperature regulation. So they're very heat sensitive and things like that. So there's a lot of, it's so funny. I hope Emily listens to this episode because we've been discussing this case often. Hi, Em. And I was talking about how I was the husband did it. That was very much an opinion that I held.
You and your little fists when you do that too.
He did.
I'm ready to meet a man. You need me?
It's so true. It's so true. I'm gesturing more thinking about this. No, but I think that I was very of the mind of that because there's some evidence, but again, I think not understanding psychosis fundamentally is probably why I've been able to like arrive at that opinion for a brief period of time. Because as we're talking about this more, like for me understanding functionality, this is very possible. This is
Unfortunately.
very, very possible. I think the other thing that, again, it's almost like we're working in reverse, right? Like we're getting this evidence, we're seeing the story, and what we're trying to do is we're trying to take what we know now and then like put that onto what the relationship between her and her husband was before. And you really can't do that here, right? Like there might not be a relationship between how flat his affect is on the stand and like how much effort he was putting into childcare. Right? Like we want to draw those conclusions to support our own hypotheses, right? And do I think that his affect is weird? Yeah, that shit's
married
crazy.
like 4 years later or 4 months later to a person that looks identical. Yeah, weird stuff happening. Yep.
You're going on a vacation 3 weeks, like, you know, and again, we've had conversations about how people process grief and trauma in very different ways, but I do think there is strange, I'll just call it strange behavior. It's strange. It's not really what I would expect, especially when you're seeing like first responders and the children's preschool teacher like crying on the stand, you know?
It also kind of reminds me of like, I mean, you know this about me, but I don't even think I've said this in this episode. Like I am a true crime girly. Every true crime case that I really get into is there's always just stuff that just doesn't, there's always just a few things that you're just kind of like, why? Or that just doesn't feel right. And I think that's because we're literally talking about something that's not supposed to happen. And Ashley always says this, and it's such a good reminder of trauma doesn't have to make sense for it to be real. This did happen. I get that we're all trying to, and we should try to find understanding and to wrap ourselves around that. But the fact that there is a belief here of I should kill my children and then I should kill myself is never going to be something that we feel comfortable with or that makes sense to us.
Yes.
That's the way it is. And everybody, you all deserve your moment of grief and recognition of that, of how is that possible that a loving, caring mother can become the opposite of herself. I think that is maybe the biggest nightmare that I'm getting chills even just thinking about that. Like there's not much worse as a human being than you can experience than becoming the thing that is the opposite of your values, the core aspects of yourself. This is a woman who worked with children, who always wanted to be a mother. She wanted this life. It was everything to her, and she destroyed it. That is very hard to sit with and look at. And just like when we see a homeless person on the street, we kind of want to go like, that couldn't ever happen to me. They must have done something and we want to push it away. And I guess with that, I just want to caution everybody to that. Like your desire to want to push it away makes sense, but don't follow that.
Because it could have been us.
Yeah.
And Nikita and I have had these private conversations of like our fears related to like having children, right? Like what would that look like? What could happen? I think these are very real fears that people who can become pregnant live with, that people who can't become pregnant might not understand. Because we're sitting here and we're talking about Lindsay Clancy and her children, and it did happen to her. It's very real. And to your point, sometimes it shouldn't make sense. If it made sense, maybe I would start being worried.
That's the whole.
I'm not supposed to understand it because that's not what I experience. That's not how I interact with the world.
This happened.
Right. Maybe it's not for you to understand, and maybe that's okay. But I think like to pull out, pieces of this, it really is an important conversation to have about caring for people that can become pregnant and have children, and what that looks like.
I really hope, I know that that's something I'm going to take with me. I hope everybody does, of just, if it's your friend and they're trying to get pregnant, or they've had a loss of a pregnancy, or they've had a beautiful, wonderful, successful one, giving birth to a child, bringing life into this, even going through the process of trying to do that is a tremendous one. And it comes with huge changes to our bodies, our minds, our identities, our family units, our existence. And so reach out to one another, show up. Like, I feel like this is one of those times where, like, don't wait for people to ask for help to show up, and just be like, what do you want to do today? What would be helpful today?
Like, I couldn't imagine being in this circumstance and having you as one of my best friends and you not showing up to my damn house and being like, I have to help you here. Like that's what, and again, it's not to say that that didn't happen with maybe some support people in her life, right? Because you can also offer help and that help be rejected.
Which I know at times she did apparently do, because that was part of the paranoia, was like not trusting everybody at all times. But again, that's where, I mean, like, I almost wish, and this is me dreaming, but I wish like a group of women could have like encircled her and been like, you can trust us. We're going to take care of your children. But girl, like, you need to rest and eat and like do nothing but take care of you. And we've got them for a while.
Right. Which is where it then comes down to mental capacity, and then who makes the call about mental capacity, and then who makes the call of like power of attorney and decision making. Because when she was in the hospital, she was trying to transfer like who was taking care of her from Patrick to her parents.
Yeah.
Right. And like, how can you, again, waxing and waning psychosis aside, that is a very clear, to me, communication.
Right.
Of maybe I'm not trusting this person to do the right thing for my medical care, and I need people that I can trust. Right. And that's the other hard position of like potentially being in her circle and her community is like, you know, you can't show up to your friend's house that's experiencing psychosis. They tell you they're fine. You can't just pick them up and put them in an inpatient hospital.
And I think you're also raising the other half of that, which is like, if they say they're fine and you know they're not, or they say, I don't want your help and I don't want to not take care of my kids, but you know, and as a family, that has to be stepped in. Like, I can't emphasize that enough. If Lindsay Clancy had been hospitalized and given a reprieve, I very much think that she would be safe and healthy, and I think all three of her kids would have been here, and I think it would have changed the entire trajectory of all of this. And the putting her in the hospital, like, all of that would have been traumatizing in itself, but far less traumatizing than the reality that we're all sitting with right now. And I think that's such a hard thing when we're trying to respect autonomy and to say, like, you as a parent have every right to make your decisions, and who am I to say what's real and not real? But as a community, especially when we're all coming together, like, and saying, like, we're all noticing this from this person, and it's like, you can't ignore that. And it feels like that's what happened with this entire team, is everybody was saying very alarming things, and none of it was taken to the severity level for treatment that it needed to be.
It's all disjointed. It's disjointed medical care. She's saying that she's having homicidal and suicidal ideation and she has a plan and she doesn't trust herself. And yet in 14 plus visits, you know, we're not talking to each other. We're not calling and she only stayed in the hospital for 5 days. That's not even enough time to get enough sleep to like recover. Because are you sleeping in a damn hospital that no, you're not. Like, you know, and then I think they discharged her because she was like, I want to go home for like, I think it was like a birthday or something like that for one of the kids. And I'm like, I love that. But like, you know, in other postpartum units, you know, you have to earn privileges to be able to like go back into your community because they have to make sure that you're stable and safe to be around your family.
And these conversations always bring me like full circle. It always goes back to community behavioral health for me, of just community behavioral health as it's practiced is not what it was intended to be. What it looks like today is not the model of how it was supposed to be. The idea was, and it's so heartbreaking, because I can think of like a handful of people even now that I know would so hugely benefit from this, of like not having to live alone, like maybe having some kind of a shared living unit, but largely independent, and access to medication management and an ability to work part-time. Like, all of these things were supposed to be the infrastructure of community behavioral health. So that way there was enough support there that people no longer needed institutionalization, but they were also still able to have autonomy and live a purposeful life and identify what that even meant for them. And whenever I'm in situations like this, I think of what the world would look like if more systems were able to operate and hold community in that way, where it's just like, if you're a mother and you're needing more support, here, this is where you can go for that.
Yeah, it's really, I think that's such an amazing point because, especially in the work that I'm doing, we're looking and labeling interventions and saying this is successful and this isn't successful and they need this type of communication system, etc. And it's like, where is sleep? Where is diet? Where is community? Where is socialization?
Brushing my teeth, having a routine, socializing without ice, all of these basic things.
Those are interventions. That is mental health care. That is suicide prevention. I have a client that is specifically, their level of anxiety and perseveration skyrockets when they are not socializing. They are a person, like we all are. One of my friends who's a BCBA talks about like the 6 core yearnings. Like we yearn for community. We need it. It's not like we can go without it. It is preventative and it is helpful. And that's where, again, I feel like we could have a whole episode just talking about like the criminalization of mental health disorder, if we want to use that word, disorder. And what that means for livelihood and services and community. Because if we were building communities where people experiencing psychosis could have like interdependent living with other people, we would be solving the problem.
100%. And a lot of people don't even know that was the presentation to Let's End Hospitals. This idea of having these padded white room hospitalizations that we saw were really abusive. The idea was, well, what if in neighborhoods and in towns we took like large apartment complexes that were abandoned and we turned them into living units where maybe the psychiatrist and a PCP doctor were on the bottom floor and they could get help with resources like food and finding a job. Like all of that is in the building, but then they live with roommates so that way they're learning how to cook and how to take care of themselves and they're not alone. They know that they're not alone. They get to go out and live their life and then come home to community at the end of the day. That was the idea of it. And it's such a beautiful, powerful idea.
If it could only be executed, right? Like
in that way.
Because think about all of like the politics involved with like safe injection sites and things like that. Think about how many people who don't have transportation or access to regular medical care have to go across the city to the methadone clinic to like try and get off of an opioid addiction. And it's like, imagine if that was just where they lived.
Yep. Comprehensive care that has been proven to work. It's almost like if you wanted the system to function effectively, these were the things you would do. And instead, it's become every community behavioral. If I ask them, like, what's the first thing you think of with community behavioral, they'll tell you paperwork.
Yes.
Because that is the economic strong arm that has been used against nonprofits and community behavioral health of we will drown you in red tape and stipulation and tie your hands behind your back so you can't do anything and you don't have the money to anymore. Yeah. I remember talking to my administrative assistant and her name was Miss Jessie, and she had worked there for 35, 40 years. Long time. And she used to tell us about how when she had started, I remember seeing pictures of her too. She was such a babe. But I remember her showing me pictures and telling me about how they used to have family vacations with the members. So in the summertime, they had enough funds that they would just take all of the members and they would go to the Jersey Shore together.
It's what should happen.
And go to the movies. And there was funding so that way if somebody wanted to go on a job interview, but they were afraid or didn't know how, somebody could accompany them and even help them to get like a suit. And there was so many endless resources for people. That feels like the idea that there could be fun, not only for people to live in a community setting like that, but that when the holidays come, they received gifts, that there was a community dinner bestowed upon them, that they were given a birthday party, that they
Yeah.
were set on a family vacation where they were told this is your family. That's what mental health was intended to be. I don't
Yeah.
know what the hell it is nowadays, but I'm all the more hopeful that continued conversations like this one, as hard as they are, lead to some awareness and some want for
Yeah.
those kinds of hopes and dreams.
Some change, because I think the theme of, I feel like 80% of who we meet networking through Full Living Wellness, the theme is like, I had to leave the system and build something else because I know something better exists that can be provided. And I don't want to have to fight the red tape to do so. And so that's where I think the other really important part of some of these conversations is that you cannot have this conversation in a silo. We have to look at the systems that are affecting physicians and medical practitioners. Like, why does that shape their behavior? Because we all are operating within a system that is controlling and shaping our behavior, and that does affect our clinical practice, right? So what happens if we remove the system? Well, behavior changes, and maybe better or different things can
Come about.
happen, right? So I think it's really important, like when you're thinking on a macro level, like it would be so easy to demonize Lindsay Clancy. It would be so easy to
Oh,
do
yeah.
that, right?
She
But
did a
then when you
horrendous thing.
Right. But then when you actually look at it, you're like, well, this is actually a failure of the medical system. It's the failure of fundamentally like understanding and researching women's health, making that accessible. It's a failure of just like the capitalistic system that we're all living in, right? Like there's all these systems that are affecting this, and you can't ignore that when we're having these conversations. So it is, I think, like a very, I don't know about you, but I feel so deep. I felt very deeply sad the entire time we've had this conversation, because it's really hard to sit and recognize that this is what is happening.
This is the
But
reality of it.
yeah, but the hope is that having these conversations mean that we build community and we find people and we create something different.
Exactly.
You know, we
Yeah, there's
learn from
plenty
it.
there's plenty of blame and shame to go around in this case, and that probably makes it all the harder for us to sit with. It's not as easy as just blaming one person or this person, and then that's done.
Right.
Everybody has a nice helping hand that they can take of their own blame and acknowledgement, and they could sit with that for a nice long time of just looking at their own stuff before
Yes.
pointing fingers at anybody else. And I think all of us can too. I hope all of us as clinicians, as friends, as just human beings are asking ourselves, how can I be a better community member? How can I be a better service provider? How can I be more responsible and show up and not let things become negligent?
Yeah. Yeah. So I'm going to shout out again, Sunstone Psychiatry for Women. They provide out of network care in the area of Philadelphia, and they specialize in these areas. So we will include these things for you guys to look into. And if you're a women's health provider and you feel really passionate about this topic, let us know.
Yes.
Maybe we can have more of a conversation about it.
I would love to do that. Yeah. I think it's one that we have to continue on, and there's many different ways that we can do that. So that's what
Yeah.
we'll do.
Yeah, so that's what we'll do. So that's episode 39, baby.
That
This is
is
a heavy one.
episode 39. Certainly, maybe that's a good thing, because a 40 feels like a bit of a milestone. So we'll have to do something special for that. We'll figure
Yeah,
that
I'm
out.
like, do we cut a cake? Do we wear a crown or a tiara?
Any occasion to wear a tiara, I'm down. You know that.
All right. Well, I guess we'll see you guys in our next episode.
Yes. As always, friends, live well, and we'll see you in the next one.
Bye.